The results of this meta-analysis of RCTs focused on patients with CLI. And because of that, they're more difficult to interpret than the earlier femoral popliteal publication. The medical complexity of the underlying disease and the vulnerability of CLI patients contribute to a greater heterogeneity in the population. Consequently, added caution must be exercised when attempting to make conclusions from this new meta-analysis. In terms of the methodology used, the current study shares some of the frequently noted limitations of the original femoral popliteal meta-analysis. The lack of patient-level data. Again, it was not available to the authors, but without it, it is impossible to really evaluate the total dose of paclitaxel used in individual patients and any correlation with mortality. In addition, the relatively small number of patients analyzed and short follow-up, 46% of the patients had only 6-month follow-up, make any conclusions problematic. However, unlike the first meta-analysis, additional limitations are noted. The current report of pooled data includes unpublished data results. 3 of the 8 trials in the analysis have not been published. This represents 1/4 of the patients included. Nevertheless, the patient raises interesting points about the effective DCB treatment for patients with CLI and questions the possible association of downstream drug embolization and systemic effects on amputation. In addition, it echoes the call first heard with the earlier femoral popliteal publication for more data and an urgent need for adequately powered multi-center studies with longer follow-up. Its effect on clinical practice for management of CLI patients with limited treatment options right now is questionable. Most likely, future substantiation using large, well-controlled trials will be required before changing strategies for the application of DCBs in treating CLI becomes reality. Thank you.
John Kaufman here at the Pyramids. This is just my opportunity to give you a couple comments about the new Katsanos paper. This is not going to be as disruptive as the original paper. It's got a smaller number of patients, although it's focused on CLI. It's not going to have the same impact that we saw in terms of our thinking. Since debate BTK and the impact deep, we've had concerns about paclitaxel in the tibials. This just gives us more information to think about. It's not going to really change our practice. We still have to be very careful about how we approach these patients when we use these devices, and to have good follow-up. We need more studies, same as before. So all in all, I think it's interesting information. It's more to think about, but not really going to change what we do or what we think.
This is again a great paper by Katsanos and all, showing the risk of decrease of amputation-free survival after DCB below the popliteal artery. The review is performed according to the latest Cochrane criteria, and also the statistics of this study are perfect. This outcome showing a hazard ratio of 1.5 decrease in amputation-free survival is actually a big concern to me. If you add these new findings to the previous findings by the same group showing an increase in 2 and 5 year mortality after paclitaxel, I even get more concerned. Peripheral embolization of particles with paclitaxel to the microcirculation has been recognized by others too. This doesn't look good to me at all, and it's time for a study to measure fluid perfusion after drug-coated balloons.
According to the publications of Katsanos, first of all, I have to state that all safety data have to be taken serious, so that's very important. In the recent publication BTK, Katsanos did a much better job according to these statistics. Nevertheless, there are major limitations of the publication. The first one is that he mixes a follow-up of 6 months and 12 months, that's something which we cannot do. The second point is that it's a meta-analysis, but it's mainly driven by 2 studies. One is the electronics BTK study, the other is the impact deep study, and also the safety concerns come from the impact deep study only, and this has been published. So there's nothing new. Unfortunately, Katsanos did not acknowledge that we do have longer follow-up data also of IMPACT Deep, and showing that the drug-coated balloons are safe and there are not so many amputations anymore, not an increase of amputations at 4 and 5 years. So that's not true. So in summary, this publication will create a lot of confusion again. According my clinical practice, I don't change a lot, because I do think that drug-coated balloons, paclitaxel-coated balloons, are still safe. In below the knee, unlike in the SFA, it's not my standard of therapy. In SFA, it's standard of therapy. Below the knee POBA also does quite good and saves legs and amputations. So DCB therapy below the knee is only used in a limited number of patients in my clinical practice, and I don't change here. Thank you very much.